Today we are covering acute coronary syndrome, a critical topic for your nursing exam. When a patient presents with chest pain, the NCLEX wants to know your priority. Before you even think about medications, your absolute first priority is to obtain a 12-lead ECG. The test requires you to get this done and interpreted within 10 minutes of patient arrival. This single diagnostic tool is what splits your care path into two distinct directions. If that ECG shows ST segment elevation, you are dealing with a STEMI, a complete blockage of a coronary artery. This is a code red situation. The exam will test your understanding of time-critical reperfusion therapy. The phrase to remember is time is muscle. For a STEMI, the goal is to get the patient to the cardiac cath lab for percutaneous coronary intervention, or PCI, within 90 minutes of arrival. This is the door to balloon time. If the facility is not PCI capable, the patient might receive thrombolytic therapy, and that door to needle time must be within 30 minutes. The NCLEX loves to test these timeframes. Now, if the ECG does not show ST elevation, your patient is in the second category, which could be either unstable angina or an NSTEMI. How do you tell the difference? This is where cardiac biomarkers, specifically troponin, come in. You will draw blood to check these levels. If the troponin levels are elevated, it indicates cardiac muscle damage has occurred, and the diagnosis is an NSTEMI. If the troponins remain normal, the diagnosis is unstable angina. The treatment for both is similar initially, focusing on preventing further clot formation, but an NSTEMI is managed more aggressively, often leading to a cath lab visit within 24 to 48 hours. Let's discuss interventions using the classic mnemonic MONA. An exam trap is to assume you administer morphine, oxygen, nitroglycerin, and aspirin in that order. This is incorrect and dangerous. The NCLEX will test your clinical judgment. Aspirin is almost always a priority, and patients should chew a non-enteric-coated 325 mg tablet to speed up absorption. Oxygen is only indicated if the patient's oxygen saturation is below 94%. Giving oxygen to a non-hypoxic patient can actually cause coronary vasoconstriction, which is harmful. Nitroglycerin is given for active chest pain, but you must check the patient's blood pressure first. If their systolic pressure is below 90, or if they've recently taken a phosphodiesterase inhibitor like sildenafil, nitroglycerin is contraindicated. Finally, morphine is used if chest pain is not relieved by nitroglycerin, as it also reduces myocardial oxygen demand. A major pitfall on the exam is failing to recognize atypical presentations. Women, elderly patients, and individuals with diabetes often do not present with classic crushing chest pain. They may report fatigue, shortness of breath, or jaw pain. The exam will present a scenario with a patient from one of these populations and expect you to have a high index of suspicion for ACS. To keep the diagnostic path clear, use this phrase, ECG is the key, troponin sets you free. The ECG is the key that immediately identifies a STEMI, the most urgent diagnosis. Troponin is what sets you free from the diagnostic dilemma of unstable angina versus NSTEMI. Remember this order of operations and the critical exceptions to pass your exam questions on this topic.